Yeah, prices for brand name drugs have outpaced inflation for years. Now, those increases have slowed down, but it's still more than twice the rate of inflation. According to the study, the average price of brand name prescription drugs grew by nearly 3% over the past year. By contrast, the rate of inflation was a little more than 1%. AARP says that translates into a huge cost for the elderly, who rely on average nearly 5 prescription drugs every month. At an average cost of $6,600, that totals more than $31,000 a year.
We're facing out-of-pocket costs that can get as high as $10,000 per year. And if you think about the median annual income for Medicare beneficiaries, which is just under $30,000, that is absolutely not affordable.
AARP says the affordability problem on prescription drugs will lead to poorer health outcomes and higher health care costs.
What we're really trying to drive home is the importance of doing something about prescription drug prices.
Congress is once again trying to rein in drug prices, and AARP says there's one key law that could make a significant difference.
Allowing Medicare to negotiate on behalf of its beneficiaries. Because right now, Medicare can't negotiate with drug companies, and we think that they could certainly drive a much harder bargain than not negotiating at all.
One critic of that plan is the U.S. Chamber of Commerce. The chamber calls H.R. 3, the plan introduced by Democrats, quote, harmful. It claims that government price controls will cost jobs and reduce spending on cutting-edge medical research. For years, advocates for lower drug prices have questioned why Medicare doesn't negotiate prices with the pharmaceutical industry.
That is exactly the question that we've been asking. If you look at the fact that the Medicare program covers tens of millions of beneficiaries who use a lot of prescription drugs, it really doesn't make sense that it doesn't have the authority to negotiate on behalf of those beneficiaries.
AARP says the impact of escalating drug prices goes well beyond older Americans.
The reality is if Medicare spending goes up, we're going to see taxes going up, we're going to see premiums going up. This is an issue that can really touch everyone.
There is some bipartisan support to rein in drug prices, including caps on out-of-pocket expenses for people who are on Medicare. However, there was similar legislation introduced in 2019 that went nowhere. It's not clear if the legislation will pass or not this year. In Greensboro, I'm Bill O'Neill, WXII 12 News.